Hello everyone, this is Dulce Rodriguez and I'm here to present my bacterial meningitis project. Jacob, who is my patient, is a 70-year-old male who is immunocompromised, which is a weak immune system, and has chronic diabetes that is not well maintained. A chronic disease that is not well maintained means that the target glucose levels are not achieved. If poorly managed, it can lead to serious long-term complications. He had a stiff neck, severe headache, and recent changed mental status. A lumbar puncture was performed for cerebrospinal fluid, which also stands for CSF. A CSF is a group of tests that uses a sample of your cerebrospinal fluid to help diagnose diseases of brain and spinal cord and other conditions that affect the central nervous system. In Jacob's case, the appearance of his CSF fluid is clear. It doesn't have any turbidity, which means it can indicate infection of inflammation. As you can see, Jacob's CSF results appear below. It has his results that were tested for leukocytes, glucose, and protein. On the right side of the chart, it has what a normal result of CSF indicates. His spinal tap revealed cerebrospinal fluid with the very low glucose levels and elevated protein levels and leukocytes. High CSF pressure can be a sign of certain conditions and diseases. My group and I discussed doing a gram stain will be best to find out if Jacob has a bacterial infection. If he does, the test will show the infection is gram positive or gram negative. As you can see here, Jacob's gram stain results are shown. This is a gram positive bacteria and it is composed of cocci and are arranged in chains. Media tests were tested to help diagnose Jacob's microbe causing infection. The medias we tested that were going to be useful for the identification process were blood agar plate, Thayer Martin, nutrient agar, and chocolate agar plate. There was growth on the blood agar but no growth on the Thayer Martin, meaning the blood agar was positive and negative on the Thayer Martin. The blood agar plate exhibits beta hemolysis. This means it has the ability to completely lose red blood cells, resulting in a clear zone of hemolysis. This can be helpful in identifying and differentiating the bacteria. There was no growth on the Thayer Martin because it's a selective medium primarily used for the isolation of Neisseria species. The bacteria we believe, which is Streptococcus and Streptococcus agalactiae, wouldn't be found to grow on Thayer Martin because it has different growth requirements and characteristics compared to Neisseria species. A positive media plate result means that bacteria have grown on the plate, indicating the presence of bacteria in the sample. This helps identify the type of bacteria causing the infection. A negative result means no bacterial growth on the plate, suggesting that bacteria may not be the cause of the infection. It's important because it helps guide appropriate treatment decisions, such as selecting the right antibiotics to target the specific bacteria causing the infection. Now on this slide, we have the results for nutrient agar plate and chocolate agar plate, and they were both able to grow. Nutrient agar is a medium that provides the necessary nutrients for the growth of a wide range of bacteria. It allows for the cultivation and visualization of bacterial colonies, aiding in the identification for characterization of the bacteria. Chocolate agar provides the necessary factors for the growth of a variety of bacteria. After performing the gram stain in 4 media plates and looking at the results, we came to a conclusion Jacob's diagnosis is Streptococcus agalactiae. It's also called GBS, which stands for group B strep. It's a type of bacteria that can be found in the human body, particularly in the gastrointestinal and genital tracts. GBS can cause various infections, such as urinary tract infections, bloodstream infections, and meningitis. Streptococcus agalactiae is a round bacteria that grow in chains. It has a thick peptidoglycan cell wall which takes in purple dye and a gram stain, which is a gram-positive bacteria. It was able to grow on blood agar, which was used to determine hemolysis. Jacob's infection with this will be treated with penicillin G. Penicillin G is an antibiotic medication that is commonly used to treat various bacterial infections, including those caused by Streptococcus agalactiae. It's administered by an injection into a muscle, usually into the buttocks or thigh. 10 days of appropriate antimicrobial therapy is recommended for Jacob. Antimicrobial therapy refers to the use of medications, such as antibiotics, to treat infections caused by microorganisms like bacteria, viruses, or fungi. It aims to kill or inhibit the growth of these microorganisms, helping the body fight off the infection. Thank you for watching this video.